Yeah, got it. Okay, hello everyone. Nice to meet you all. As mentioned, my name is Azina Arari, and I'm one of the lupus physicians at the Lupus Clinic, having the pleasure of working with some of the speakers you heard today, and as well as you guys. It's my first in-person lupus symposium, so I'm really excited to see your faces and hear from patients. And thank you for coming and participating. So we've heard today from experts and patients, and Dr. Avini and Dr. Reynolds highlighted some of the new therapies and new treatments in lupus. I wanted to take us back to some of the other aspects of lupus care, and that is preventative measures in lupus. I want to preface this talk by two things. One, this is talking about preventative measures that are medicalized, so vaccinations, tests, screening. It's not talking about lifestyle, diet, exercise, stress management, and that is important as well as these things. Maybe lifestyle is even more important, but that's not the scope of this talk. And secondly, these guidelines, these preventative measures are guidelines, and guidelines are for the general population. It doesn't apply exactly the same to every individual, so we have to take them with a grain of salt. So with that, let's get started. So I wanted to highlight cardiovascular risk management, vaccinations or immunizations to reduce risk of infection, bone health, and cancer screening in lupus patients. And I thought one way to make this more applicable is to follow a case through our talk, so it makes it a little bit more practical. This case is an example of a patient with lupus, but lupus patients are all very different. So if your story is very different from this or similar to this, it's all expected, and same rules can still be taken into account for you as well. So this is a 49-year-old female who was diagnosed with lupus 12 years ago, and she had symptoms of rash, joint pain, hair loss, anemia, and she had lupus in the kidneys or lupus nephritis. She was treated with hydroxychloroquine, mycophenolate mofetil, prednisone. Fortunately, she responded well. And currently she's on hydroxychloroquine and a small dose of prednisone, 7.5 milligram daily. And Miss R is wondering, what else aside from my lupus treatment can I do to improve my overall health? So first, let's talk about cardiovascular health. We know that patients with autoimmune diseases and inflammatory diseases, including lupus, have a higher risk of cardiovascular disease. And that, we think, is because systemic inflammation in the body and the immune dysfunction that comes as a result changes how our blood vessels work and how plaques build in the blood vessels of the heart and elsewhere. So that's one reason, the inflammation in the body. Second reason is patients with lupus and other autoimmune diseases often have to take corticosteroids at some point during their life, some for shorter and some for longer duration of that time. And we know that corticosteroids also increase risk of cardiometabolic complications like diabetes, cholesterol, and cardiovascular disease. And we know that the generic risk calculators, like the Framingham score, for example, that are used to calculate risk of cardiovascular disease in the general population, often underestimates the cardiovascular risk in patients with lupus or other autoimmune diseases. So if you look at the general population, the cardiovascular risk is age, being a man, having high blood pressure, cholesterol, smoking, diabetes, being overweight, physical inactivity, or family history. Lupus patients have that, plus the other risk factors, which is the inflammation that comes with the disease and the impact it leaves on the blood vessels and the cardiovascular health. So it's important for lupus patients to, just as important for anybody else, it's even more important for lupus patients to be evaluated by their physicians and address all the cardiovascular risk factors they may have in order to improve their cardiovascular health. And the European League Against Rheumatism, we call it EULAR for short, has actually developed some recommendations in order to reduce cardiovascular risk or manage cardiovascular risk in patients with rheumatic disease and SLE. So I wanted to go over some of these recommendations. So we know that in patients who have lupus, if they have lower levels of blood pressure, the target being 130/80 or less, they have less cardiovascular disease. So that is a number that we strive towards, to have that 130/80 or lower. And in patients who have a higher blood pressure than that, we can use classes of medications like ACE inhibitors such as ramipril or ARBs or Canosart, and some of these medications can be used to lower blood pressure, especially if they've had lupus nephritis or they have protein in the urine when we do a urine test. High cholesterol is also another risk factor for cardiovascular disease, and it should be treated as it is in the general population with lifestyle changes and medication if needed. And finally, glucocorticoids, as we talked about, prednisone increases risk of cardiovascular disease. So it's important to strive towards using the lowest effective dose of prednisone for the shortest duration of time, if possible. And other risk factors, so we know that lupus patients, some of them have antiphospholipid antibodies. So these are antibodies in the blood that can increase the risk of forming blood clots. And if they have antiphospholipid antibodies, even if they don't have symptoms, if the antibodies are in what we call a high risk profile, depending on the number of antibodies they have, using low dose aspirin, so a baby aspirin, can reduce risk of cardiovascular disease. And as we talked about, lupus itself and the inflammation increases risk of cardiovascular disease. So in order to reduce cardiovascular risk, it's important to try to get the lupus into remission and into low disease activity as much as possible. And finally, we've heard hydroxychloroquine many times this morning. This is a medication that we use in almost all of the lupus patients unless it's contraindicated and not tolerated. And this medication, as Dr. Arvinia mentioned, has been shown to reduce risk of cardiovascular disease as well. So one of the challenges that hopefully we can address in the future is identifying, aside from these things, identifying what are the patient subtypes that increase risk of cardiovascular disease. Is it the type of disease they have, the duration of disease they have, sometimes the other demographics, such as age, race, gender, etc., and trying to really utilize those to look at every patient with a very specific lens and reduce their risk of cardiovascular disease. So Mrs. R, going back to this patient, with these recommendations from EULAR, she tried to do a few things. So she worked with a rheumatologist, and she was fortunately able to slowly taper off her prednisone in 12 months and just stayed on hydroxychloroquine. Sometimes that 12 months might be longer. Sometimes we might have a few bumps in the road, but it's important to try to get it down. That's what this case is trying to emphasize. She also met with her family doctor and found out that her blood pressure was slightly higher than the target we mentioned. So she has started ramipril as a blood pressure agent and reduced her blood pressure. She has an annual visit with her family doctor that checks her cholesterol and diabetes, and she's been doing well from that perspective. She has been tested for antiphospholipid antibodies and doesn't have them, so fortunately she doesn't need to be on low dose aspirin. And finally, she also tries the lifestyle aspects of following a Mediterranean diet and exercising and trying to minimize alcohol and smoking in order to improve her cardiovascular health. So the second aspect that I wanted to talk about was vaccinations in lupus. And again, these are guidelines. Every patient is different, so talk with your physician about what could be right for you. We know that in lupus, there are disease factors based on how lupus impacts the immune system function, and also medication factors. So some of the immunosuppressive drugs we heard about this morning, like rituximab or steroids, they change how your immune system is able to fight off infections. And because of these changes, patients with lupus have a higher risk of getting infections. And especially if they're on certain medications like steroid or B-cell depleting therapies like rituximab. And so it's important to look at vaccinations that are available to reduce risk of infection. And ideally, we want to give vaccinations when the disease is quiescent, and ideally before we give immunosuppressive drugs such as rituximab. We don't live in an ideal world, so sometimes these things don't work out, but you try your best and we try your best. So one of the recommendations is about influenza vaccine. It is strongly recommended that patients with lupus consider influenza vaccine on an annual basis. And studies show that even though because they're on immunosuppressive medication, the antibodies they build, or we call seroconversion, may be lower than the general population, they still get benefit and immunity from getting the influenza vaccine. Similarly, if they're on a DMARD, so immunosuppressants, that there's many of them, you've heard some of them this morning. If they're on DMARDs, it is best that they also get a pneumonia vaccine. And the current recommendation is to get the PCV13 followed by the Pneumovax 23, 8 weeks later. And the Pneumovax vaccine can be repeated 5 years later. And with the COVID pandemic came the SARS-CoV-2 vaccine, and that is also still recommended to consider and for patients with lupus and other autoimmune diseases in order to reduce their risk, especially if the patient is on a drug like rituximab that's very immunosuppressive, or cyclophosphamide and steroids. Those patients have a higher risk of having severe COVID if they get ill with it. And so those are the patients that ideally we want to get them the vaccine as soon as possible, and ideally before they are on those strong immunosuppressive medications. Shingles is something that we've heard about today, and you may have heard from your other family members and friends. It's an infection that is very uncomfortable for many patients and can have lingering impacts with neuropathy. And we know that patients with lupus have a higher risk of shingles. The incidence rate coded for shingles in lupus patients is 30%, and that's 6 times higher than the general population. So for that reason, considering the Shingrix vaccine, which is the non-live recombinant zoster vaccine, is important to reduce that risk. Unfortunately, there is a cost associated with this vaccination. So you can always work with your physician and your insurance to try and navigate that. And finally, we know that patients with lupus also have a higher risk of contracting genital HPV and getting cervical cancer. And so HPV vaccine is also recommended for lupus patients. So with these recommendations, Ms. R considers the COVID vaccine and the influenza vaccine on an annual basis. She talks about it with the rheumatologist. She has received the Shingrix vaccine. She's received the HPV vaccine. And because she's only taking hydroxychloroquine now, she's opted to not take the pneumococcal vaccine. Next is bone health and how to prevent our bones from becoming osteoporotic and breaking as we get older. So again, it's important for lupus patients to review their bone health with their physicians, family doctor, rheumatologist, on a regular basis, every 1 to 3 years. And that's looking at their risk factors, what are the things they're doing in their life or medications that increases risk of osteoporosis, and sometimes even doing a bone density scan to look for osteoporosis or osteopenia. And for promoting bone health, lupus patients and other general population should take vitamin D, calcium, ideally through diet, if not possible through supplementation, and exercise. So Ms. R has had a bone density scan because she's been on prednisone for all these years. She takes vitamin D. She tries to have adequate amount of calcium in her diet, and she tries to incorporate weight-bearing exercises as much as possible. And the last segment of the talk was age-appropriate cancer screening. So we know that, as mentioned a few seconds ago, patients with lupus have a higher risk of contracting HPV and having cervical cancer. In the general population, usually cervical cancer screening, or pap test, is recommended every 3 years between ages of 25 and 69 for people who've been sexually active. In lupus patients, because of the changes in their immune system, as well as some of the drugs they take, and their immune system being suppressed, they have a higher risk of cervical cancer. And so it's recommended, although it's low-grade evidence, it's recommended that lupus patients have pap tests on an annual basis. Again, this is low-grade evidence and dependent on the patient and the risk factors. So not saying everyone should always have an annual pap test, but it's important to be aware of this and discuss it with your physician, see if this applies to you and if this is something that you might want to consider. Other malignancy screening. So breast cancer screening is not different in lupus patients than general population. So mammogram every 2 years. In BC now it's recommended between ages 40 to 74. Colon cancer screening, same as general population, doing a colonoscopy or FIT test between ages of 50 to 74. And after that age depends on every patient. And these screenings are all, again, general population, and every patient's risk factors can change that. So if you have a family member with this type of cancer, the recommendation may be different for you. And so Ms. R also, again, she is opted to follow with the annual cervical cancer screening. She does the FIT test next year when she turns 50. And she just had a mammogram last year, which was normal. So she's all up to date with her age-appropriate cancer screening. So that's the end of my talk. If you have any